great.
Okay.
Didn't see you. It's
Thank
so
you.
dark.
Thank you, Jerry. Thanks, Atan. And I think I must congratulate Dr. Jerry Schulz for this course which he does. He's now been coming to India close to 40 years. So thank you, Jerry. Hope, and I'm sure we'll keep doing this course again and again every year. So I am going to be talking about genetics of corneal ectasia, and corneal ectasia would include the gambit of keratoconus, pellucid marginal degeneration, as well as keratoglobus. And the incidence is one case per 2000, and although it is mostly sporadic, the genetic basis is seen only in 10% of the cases. The prevalence is six-fold in Asians than Caucasians, and much more in Indians than other Asians. And I think with the advent of the diagnostic tools that are there and available to us, this is increasingly being diagnosed more often as compared to what it used to be done earlier. So genetic basis of keratoconus, if you see, it has a sporadic distribution with 10% familial genetic inheritance. Autosomal recessive or autosomal dominant pattern of inheritance is also seen in different ethnicities. Rabinowitz reported 0.23 to 0.05% of keratoconus in prevalence of the general population, and 3.34% prevalence is reported in first degree relatives and concordant in monozygotic twins. If you look at the increased corneal curvature, it has been found to be an important inheritability trait, and as per the Beaver Dam Eye study in 2009 on 715 individuals in 185 families, they reported 95% prevalence. Now, the advent of newer technologies like the next generation sequencing, the GWAS, RNA sequencing and linkage mapping have showed identification of multiple gene associations in keratoconus, and the VSX1 gene is the one which is most commonly implicated. These mutations were reported in the pathogenesis of keratoconus from Australian, Indian, Caucasian, Iranian and Italians, but not from many others also. And having said this, VSX1 gene is also associated with other disorders like endothelial corneal dystrophy, fixed dystrophy and posterior polymorphous corneal dystrophy. Now, the ethnic variation, low frequency of changes and polygenic nature of the keratoconus are the primary reason for conflicting report of the pathogenicity of VSX1 in keratoconus. And although we look at these mutations, but it itself is not a suitable biomarker, but only a possible one. So this just shows the pathogenic VSX1 gene mutation and a novel mutation that we actually found in our cohort when we did a study on 50 keratoconic corneas. The mutations in the VSX1 home box gene for two distinct corneal dystrophies are also shown here, that is the PPD and the keratoconus both, as shown by the other group of investigators. Now, this is basically to show the SOD1 gene, that is the differences in the SOD isoenzyme distribution in keratoconic corneas in the stromal region. And although brittle cornea syndrome is not linked directly to the keratoconus, but brittle cornea syndrome, patients of brittle cornea syndrome may have keratoconus, and this is just to show that it is a generalized connective tissue disorder characterized by thinning and fragility of the cornea, which can develop even after minor trauma and is associated with homozygous mutations in ZNF469. Now, the TGF beta pathway also plays an important role in the pathogenesis of keratoconus, at least in the Chinese population it has shown so. And in this study, which was done by Hughes et al., mutation in the region of MIR 184 was responsible for familial severe keratoconus combined with early onset anterior polar cataract by deep sequencing of a linkage region known to contain a mutation. Now, this is from the same study, and then we've also looked at the mitochondrial DNA in 20 keratoconic patients and 20 controls, and the mitochondrial complex were sequenced, and in our study 20 keratoconus and 20 controls DNA sequencing revealed 84 nucleotide variations in the keratoconic patients and 29 in the controls. So there are SNPs which are present in keratoconus which have been identified by the GWAS studies which are as shown, And then keratoconus also has comorbidities with multifactorial interactions, which are not only because of the genetic association but also biomechanical, biochemical and environmental. And also many of the syndromes are associated with the keratoconus, which also have a genetic basis. So gene therapy in keratoconus is, I think, the way to go in future, and cornea is an ideal candidate for the gene therapy because of immune privilege and because of the vector mediated gene transfer, both viral and non-viral. The future directions are that the recent molecular characterization of keratoconus, because of it being inflammatory disorder, as has been shown by the increase in the biomarkers, and so the limitations are that there is not a very good in vivo heritable keratoconic model which exhibits dissimilarities to the human keratoconic corneas, and in vitro keratoconic models hold promising avenue, but we do require human cell based 3D in vitro tissue engineered model for keratoconus that may be the future, and that may closely reflect the properties of an in vivo disease tissue.